Welcome to myFace, myStory, Voices from the Craniofacial Community, with your host, Dina Zuckerberg.
Hello and welcome. You are tuned into myFace, myStory, Voices from the Craniofacial Community. Don't forget to click subscribe so that you'll never miss a future episode. I am Dina Zuckerberg, Director of Family Programs at myFace. I was born with a cleft lip, a hearing loss, and no vision in my left eye, but it has never stopped me from doing anything I've wanted to do in my life. I had 6 surgeries, years of orthodontics, and speech therapy growing up. I was teased in school. Kids would say mean things, and I would sit alone sometimes on the school bus and in the lunchroom. I always say there is power in the shared story in knowing you are not alone. So anyone out there like me, I see you. We all do. It's about people like us being seen and heard, about sharing stories from the craniofacial community. This is a safe space, a space where the voices of the craniofacial community are heard. Thank you so much for joining us as we discuss trauma through the lens of those of us growing up with craniofacial differences and how we have been impacted by medical trauma from the many surgeries, medical procedures, and hospitalizations all of us have had in our lives. Many of us have also experienced trauma related to bullying because of our facial differences. Also, how it affects not just us, but the whole family as well as other aspects of our lives. I am thrilled to be joined by our special guests today, who will share their stories and offer their own tips for coping and working through the trauma. Before we begin, I just want to reiterate that we are all people with craniofacial differences talking from our own personal experiences. We are not licensed mental health professionals, and what we say here is not meant to replace professional mental health services you may seek in your search for healing and wholeness. I also want to add that our conversations today may include references to traumatic experiences with various medical treatments, procedures, or surgeries, as well as body image, depression, anxiety, and harassment. If any of these topics are hard for you, please take care of yourself and reach out to your support systems. And now I would like to bring on our special guests, Ava Beeler, Halley Crane, Nicole Hilton, and Rena Rosen. Thank you. I'd like to ask each of you to briefly introduce yourselves. Ava, how about you start us off?
Hi, my name is Ava Beeler. I am 18 years old. I live in Portland, Connecticut, and I have a cranial condition called Pfeiffer syndrome type 2, and I have had 30 major operations on my face.
Thank you. Halley, would you like to introduce yourself?
Yeah. Hi, my name is Halley Crane. I'm 27 and I live in Santa Monica, California. I was diagnosed with jaw and sinus cancer when I was 10 years old, and I've had about a dozen surgeries ranging from minor to some very major.
Thank you. Rena?
Hi, my name is Rena Rosen. I am 33. I live in Chicago. I was born with multitude of craniofacial differences, so cleft lip and palate, craniosynostosis, hypertelorism, and other differences. And I've had about 13 or so surgeries amongst the 20 plus years. My last one was when I was in my 20s.
Thank you. And Nicole?
Hi, I'm Nicole. I live in Sacramento, California. I have Pfeiffer syndrome type 1, and I've had over 30, I don't know the exact number, but somewhere in that range, surgeries, and most of them have been pretty major.
Thank you. So before we begin our conversation, I think it's important to first define trauma. Trauma is a person's physical and emotional response to a distressing experience. Few people can go through life without encountering some kind of trauma. But unlike ordinary hardships, traumatic events can feel beyond a person's control and can overwhelm their ability to cope. These stressful experiences can have lasting adverse effects on a person's mental, physical, and social, emotional, and spiritual well-being. Most importantly, events are traumatic to the degree that they undermine a person's sense of safety and stability and can interfere with normal daily functioning. There are several kinds of trauma a person might experience. Medical trauma is a psychological response to painful or frightening medical procedures. This might manifest as anxiety or distress when thinking about a medical procedure, persistent thinking about an upcoming surgery, or attempts to avoid having a necessary procedure performed. Trauma can also result from persistent bullying, leading to intrusive memories, attempts to avoid school, or other places where bullies might be present, and physical and psychological stress. I'd like to ask Rena if you can share maybe how trauma has manifested in your life.
Sure. So from a very young age, having surgeries from the time I was a couple weeks old or a month old until my 20s, I could never walk into a doctor's office or a hospital without like having a visceral reaction. Smells would set me off. Sights would throw me off. Anytime a doctor would come in, I'd get hives and start having like a little bit of a panic attack. And so as I would have more and more procedures and more surgeries, I would dread going to the hospital because I knew sometimes knowing what to expect is worse than not knowing what to expect. And so having that fear already of the known was difficult. And then as an older adult, having been, past my surgery days, I still, when I go to the doctor's office, I need to ask, can you tell me what you're going to do before you do it? Sometimes I take something to eat with me so I don't pass out. I mean, it's, it's like a reaction to the feelings that I had going through those experiences that still show up in a lot of different ways.
Yes, it's interesting what you talked about going into the hospital, because I still sometimes to this day, I don't like going into the hospital. And even when I go to doctors, I get so anxious to the point where it's like I'm not even aware that I am, but I feel it. It's like my hands start to sweat. I get very, I definitely have a reaction when because I think of my own experiences. Ava, did you want to add to that?
Yeah, actually, trauma for me is pretty similar to you, Dina. Like, if I walk into a doctor's office, I'm immediately like, I got butterflies in my stomach, my hands just start sweating, and I always start thinking of like the worst possible case scenario, like whether it's like bad news or like something happens. And I think it's mainly just because I've been through so much, and sometimes it's a lot to take in and it's a lot to grasp. And trauma can come in many forms. And I think the thing that helps me out is when I ask the doctors questions, just what are you going to do? What's next? What's on plan B? Like, I want to know everything. I always want to be involved.
Yeah, I think I've learned as I got older. I think when I was younger, I kind of didn't want to know, but as I've gotten older, I feel like being prepared and knowing really helps because I think, like both of you said, I think it's the anxiety of the not knowing when going in can really make it so much harder. Howie, did you want to add anything?
Yeah. So my anxiety and trauma kind of manifests itself in a little bit of a different way. I actually disassociate every time I go to a doctor's office, and pretty much every time I go to a hospital, I have kind of an out of body experience where I don't really kind of pay attention to where I am or what I'm doing. So much so that sometimes I'll even ask someone to be on the phone with me or come with me to a doctor's appointment to take notes because I kind of just won't really hear it. And that actually comes from, being 10 years old and being rolled into a hospital room or an operating room, a bunch of times. And I remember every single time going into the room, I kind of would just go into this little daze where I didn't really know, not just only because of the medication being pumped in me, but also just as a coping mechanism, you kind of detach from your body, or at least I did. So I still actually have that all the time. Sometimes, at doctor's offices, but also kind of throughout my life. I have issues kind of being present and feeling like my feet are on the ground, oftentimes having out of body disassociation experiences. And I really think that comes from coping with that trauma.
Absolutely. Rena, did you want to add?
I was just going to add that one of the other responses that I have is anytime I have any sort of, because of all the things that I've gone through with surgeries and with, health related, things related to the surgeries and craniofacial differences, anytime like my throat hurts or my head hurts or my sinuses are congested, I get like very like, investigative of what is it and could it be something related to what I the craniofacial differences, and it could be nothing, but I start to like get into this dark hole of it could be something really, really bad and it's probably nothing and I probably need nothing, but I need to like be validated by other people that it's nothing.
Right. We actually have a comment that my 17-year-old highly intelligent son goes selectively mute when he has to see his doctors at the hospital. Definitely high medical trauma. So I think we are certainly not alone in our experiences. So related to this, I think for us and many in the craniofacial community, it is cumulative trauma, meaning the surgeries of bullying can continue into later life. And it's not just a one-time trauma like a car accident. And I think, I'm guessing you guys would all agree with that. I think, and I think we've touched on it, how it can be very cumulative over time. So Ava, what would you say has been the hardest part of all of this for you in terms of the surgeries and the medical care, and anything else?
The waiting. The waiting is the absolute worst, I think, because personally for me, I've gotten so many doctors who have told me like, oh, you're going to have surgery like in the summer. Unfortunately, I'm the type of person who will worry about it for 2 months straight or however long, how many days the surgery is. I will count down the days and I feel like I've been hit by a wall of this news. It's just so overwhelming to process. And sometimes it takes time for me to process it. And sometimes it's just a really intense thing. And I get like really anxious. And I've always been such an anxious person since I was little. I can remember. I've always just been a nervous person. And I think, the hardest part is just the waiting game, the what ifs, putting in the worst case scenario possible for a surgery. And you're basically just trying, at least for me, I'm always trying my hardest to put positive thoughts into my head and just say, it's going to be okay. It's going to be okay. You're going to be okay. Yeah. So.
Yes, I can relate to that. Howie, did you want to add?
Yeah, definitely. I think something that I often feel like I have to explain to other people is that nothing that we're getting done in the hospital is like standard. Like, we're not going in to get our tonsils taken out. We're not going in to get something done that, like, oh, people are like, oh, I got that done last week. Everything, for the most part, I think for a lot of us has been, something very novel and custom, and something that not only takes time to just schedule, but actually to create, as a surgery, to get a care team that can actually handle that, to get a facility that can handle that. All of that takes waiting, and oftentimes they get changed, right? Like, surgery dates get changed, or the amount of recovery time you thought that you had for something ends up being 5 times that. So that changes your entire plan for your career and your relationships and where you're living and your life. And every single time that happens, you think it's going to be different or better and you're going to cope with it better, but you might not. And in my case, like, I didn't every time. And I think, to go with my trauma too, it's like this, disappointment of expectations from both, either a care team or just my body's ability to bounce back, or just simple as like scheduling something that is very much new and novel is very frustrating.
Yes. So how do you emotionally prepare for upcoming surgeries and medical procedures? Nicole, I don't know if you had anything you'd like to say on that.
Oh, sure. I mean, there are so many ways that it depends on the person, of course. I think one of the central things for any patient going into the unknown is to schedule as much as possible that will be familiar and comforting. For some people, that might be having the same setting that you're used to before the surgery ready for you to come back to. For some people, they might want to go somewhere different, or they, might want to go to a family member's space that's more comforting than the normal place where they're used to staying. But just having, I don't know if that even makes sense, but having a space prepared, I think, can be really beneficial. That, you can never expect everything to go the way that you want it to, because it just won't. But you can at least have something waiting for you that will be comforting: a pet, a space, a book, something of a ritual to come back to, I think is really helpful.
I remember the last surgery I had, I prepared myself, and because I always used to get really anxious before surgery, like really bad. And the last surgery I had, I really worked on things that I wanted to bring with me, like my music. So I had my music on my iPod, and I had a friend come with me, not just my parents. And I did all these things, and breathing exercises and all these things that really helped me. I was so much more prepared and so much less anxious as a result of that. So it really was helpful. Ava, did you want to add something?
Yeah, to emotionally prepare, for me, it's just talking to anybody, like asking questions about what is about to happen. So, like, for me, it's talking to my doctors, talking to my parents. And sometimes what I do to emotionally prepare for it is, it's hard to predict what surgery is going to look like, but you can kind of anticipate how your recovery is going to be. So I plan out what I'm going to do after surgery. I'm like, okay, I'm going to watch really cool movies, or I'm going to read a book, or eat this many candies and ice cream. I try to think of something to look forward to as I'm anxious about this one thing coming ahead.
Right. So I think it's important that to find a care team that you trust and can really help you prepare for the upcoming surgeries. I think that's important too. And I'm just wondering, what advice do you have for the surgeons and doctors so that they can do a better job, i.e. speaking directly to the patient, not in the third person? I've heard people say that sometimes they feel like they're in the room, but they're not being addressed, and that can bother them. So I'm wondering if there's anything anybody would like to say on that topic. I don't know, Rena, if you have anything you want to say on that topic.
A lot. So the majority of most of my surgeries were from the time I was an infant until I was in my teens, and then a couple in my 20s. And, doctors and surgeons always use medical terminology to explain what was happening or what the surgery was going to be, but that I didn't understand what they were talking about, and they would talk about it to, my parent who was with me. And so as I've gotten older, I am very clear on like, I would like you to explain it to me in terms that I can understand, because that helps a lot with the anxiety of what's going to be happening to me, especially because, when you have so many things going on, whether it's craniofacial differences or any type of medical trauma, you're so hyper aware of your own body and being in control of your own body. And so having that information is really important. And there's a lack of sensitivity sometimes with the medical professionals, thinking that they know what's best for their patients when they don't know the past trauma that we've gone through. And so kind of giving a little bit of like information and having some shared empathy and conversation before they tell you what they're going to do to you is
Yeah,
really helpful.
absolutely. Ava, did you want to add to that?
Yes, I think that it's really important to make sure that, the doctors maybe ask like a simple, small question, like, how do you feel? Or do you have any questions about the surgery? Because even though we're young, like, even though we're really young, we still have a voice, and our voices deserve to be heard. And I think it's really important at even a young age to be involved with the surgical process, because even if you're confused about what the doctors are saying, ask questions. Always ask questions if you're confused about words. I know that when I was little, I was very nervous about certain words that they would use. I would call them big words.
Mm.
And I would be like, that's really scary. Could you put it into smaller context that I understand? And they would. So now I'm very thankful that at 18 years old, I can sort of take the lead on anything. Like when it comes to like talking to my doctors, I just talk to them myself now. And then my parents kind of chime in when they feel the need to, or if they want to help in any way. But I think getting your child started at such a young age, even if you have to reword a couple of things, is really great for their teen and young adult years.
Absolutely. And there is this transition, right, from when you sort of start to be able to speak for yourself and to say what you want. I think is really liberating in some ways when that transition happens. Nicole, did you want to add something?
Yeah, I think a lot of times from the perspective of the medical professional, they will look at the patient and almost see like a cloak covering them of the condition, whatever that may be, and so the medical professional will look at the patient and speak sort of in a way that's impersonal but related to the condition and not the person. So for example, I've had a lot of surgeons talk to me about what will be done, and instead of saying, my eyes, they'll say the eyes, things like that, where it's, little differences that show you that the professional's thinking about you in terms of kind of problem solving, right? And not speaking to you the way that they would speak to another person without that condition. And I think something that families can do, in addition to talking with the doctor about changing that phrasing, is just to speak about the same things with the child, with the patient, in more personal terms, to kind of counteract, I guess, those experiences that are much more clinical.
Right. So we have actually a question. How have each of you navigated going from oversight of your parents to managing your own care and decisions as an adult? And then someone says back in the 90s, they would record into a recorder and say patient number. But does anybody want to answer the question of how did you go from having your parents, I guess, make the decisions and to managing your own care? Anybody want to address that? Okay, Halley.
Yeah, I think this has actually been one of the hardest things for me to do. I didn't really know how to take ownership or advocate for myself for a lot of my surgeries up until very recently, actually. And I think, you know, when you have your parents kind of managing everything for you, that's wonderful. And that's so helpful, especially as a child. But it's incredibly difficult. And I think to start, what I did was to just ask a ton of questions at my doctor's appointments, and to the point of maybe being a little bit annoying to my care teams, but making sure that there was total transparency at every turn, and also to understand just how things work, such as, you know, when a doctor says your recovery time is going to be a month, it's probably going to be around 3 times that. Like, that's just, for me at least, that's kind of the expectation that got drawn. And because I knew that, I then was able to really understand and just be a little bit clearer with what my questions really were. But I think this is something that I still struggle with tremendously today.
Yes, and I think expectations is a really interesting, and I have a question about that. But before I do, Ava, did you want to add to that?
Yeah, so being 18, I'm currently sort of in the transition of, you know, taking over my care and like talking to my medical team, who are fantastic, by the way. I'm very lucky. I would just say that it's really hard. It's really challenging. All of a sudden, it's like, oh, wow, all the spotlight is on you. And sometimes that can be a bit overwhelming, but also really powerful, because you have a voice and you can share your opinions and you can share your thoughts and feelings. I mean, I know I do. And really just make sure that, you know, you understand everything, that you are all at the same understanding of what is going to happen, and just overall making sure that we all understand everything. And yeah, that's it.
Thank you. So we actually have another question. How did you feel during the healing process? I always found it harder to go out in public and manage my expectations of the results. Anybody? Nicole?
This is a great question. You know, how does someone feel during the healing process? I think it really depends on the procedure, and I think it depends on the phase of life you're in. Sometimes it's been a lot more difficult. I can think of parts in my, you know, phases in my life when a lot of other things have been going on, and that's made the healing more difficult. But in terms of going out into public during the healing process, I think just having compassion with yourself and not forcing yourself to wait until you feel perfectly healed and perfectly stable to go out, but letting yourself do what you need to do, go out and acknowledge that it's going to be a struggle sometimes, you know, and being able to let yourself feel that and not forcing yourself to leave it at home or in the recovery room. Does that make sense?
Absolutely. And I think you're right about that. Rena, did you want to add to that?
I was going to say exactly what Nicole said, that, you know, kind of setting the expectation to not expect anything, right? And give yourself like the grace of, you just went through something very big, and also, you know, giving yourself that time, if you don't feel ready, not to push. I think Nicole, you said this too, but not to push yourself, you know, when you don't feel comfortable, because that could make it, you know, worse for yourself or for your child. And kind of just, if you're the parent of a child, listening to them and letting them be the guide of when they're ready and when they're comfortable. Yeah.
Thank you. So speaking of expectations, I've heard people say that it's hard when you have expectations of how surgery will greatly improve your appearance, and then it doesn't quite do it in the way that you had hoped it would. Have any of you had that experience, and how did you cope with that or not cope with that? Ava, did you want to touch on that?
Yeah, so for me, when I have an expectation and it doesn't go as planned, there is a lot of frustration and anger. I will just put that out there. The first thing that comes to mind is just absolute frustration, absolute anger, just because you plan this all out in your head to the best of your abilities and based on what your doctors tell you, your hopes. But sometimes stuff happens and you have to kind of rechange or like reprogram your brain to like I don't know what the word is, like just go through this process. And sometimes that's hard. And sometimes you go through this grieving process, and sometimes you get angry, and sometimes you get sad. And that's okay because you just have to ride through the emotions and you'll get through it.
Yes. And I'll add that I think the use of language telling patients or kids, oh, you look so good, or the emphasis is on appearance, and it's always there sometimes in one's family, at school, doctor's offices, which can add to the stress and even the trauma. Does anyone have any thoughts on that? Nicole?
Definitely. I feel like when I was much younger, I had very specific expectations for the outcomes of my surgeries. And I think when things wouldn't go quite as planned as I had planned, I would sort of, maybe not consciously, but definitely subconsciously, I would think, oh, the surgeon didn't really have the vision that I thought he did, or she did. And I think getting older and understanding that it's not really like that all the time with surgeries. It can be, like you were saying, Ava, there are so many different reasons that things can come up, that things can heal in a way that you didn't expect or not heal. And I think for families, focusing on the healing aspect and the health aspect of the patient rather than the visual outcome is very, very important. So that there isn't just an expectation for a visual outcome, but that there's an expectation for health and for growth and for progress in other areas. And so being able to focus on that is huge for families and patients.
Absolutely. I agree. So I'd like to shift just a little bit, but not spend too much time on this because I think we could have a whole podcast episode on this. But would anyone like to share their experiences with bullying and how this has maybe been traumatic for them? I don't know if anybody has any thoughts on that. Rena, I don't know if you've experienced that. Or
I wouldn't necessarily say it was bullying. More so, I've dealt with a lot of staring as a child. And so a lot of times it was when I was in public spaces and children didn't really know, what to say or if they should say something, or so there was always that like elongated stare, and parents wouldn't know how to react to those stares. And so instead of saying hello or smiling, they just stare along with their child. And so that happened quite often. Not so much in my own community because everyone knew me and everyone knew who I was. And so it wasn't like, here's Rena with a craniofacial difference. It's just, I was Rena. But it was more so like in stores or at like public places where the stares were quite evident.
Right. Yeah, I think sometimes it's not so much the outright bullying, but more than being excluded, being talked about or stared at can be just as hurtful, if not sometimes more hurtful than the outright bullying. And I think I experience a lot of that. And I think it can even, as we get older, it can even happen in the workplace. So it can happen when you're out in public. It's not so much even when you're growing up in school. So I think that's so true. So how has your prior experience affected your trauma, and what do you think are the long-lasting effects of trauma for yourself or for others, I guess? Nicole, did you have anything?
Long-lasting effects of trauma. Going back to what we were talking about a little bit earlier, similar to Halley, I definitely dissociate, and that's been something that has come up a lot, and it's something that I didn't quite understand until a few years ago. But I think that it can be an underlying effect for a lot of patients without an active realization of it, where there will be you'll be in PE, or you'll be doing some other kind of physical activity that seems extra hard, or it just isn't making sense. And I think a lot of that has to do with not being connected to the body. And there are so many different ways to approach that. I think studying, people can just Google this, but there are so many different outlets for help. Grounding is a huge help for a lot of people. And so for me, that's the biggest thing that I would say stands out with in terms of long-term traumatic effects is just being in general disconnected to my body. And it's something that I'm studying and trying to work on every day.
Yes. And Howie, did you have anything to add?
Yeah, definitely. I think also an effect of that disassociation for me is living life based on extremes, where I oftentimes find myself doing something very extreme, or thinking that I have to do something very extreme, or very quickly, or constantly moving very quickly, because I've either lost time because I've been in surgery and I've been in recovery for so many times, or when I'm, in that recovery stage, that I just can't do anything at all, that I just can be in recovery right now, and I can't push myself to do anything at all besides that. So I find myself for just a lot of things, like in my career and in some of my relationships, and even just like going out to the gym or something, I try to go really, really hard, or I try to just do nothing at all. So it's almost like a fight, flight, or freeze response that seems to often be kind of out of whack. And I'm still actually trying to understand that.
Yeah, I think there's so many different sort of reactions one can have to the trauma. Rena, did you want to add?
Yeah, I just was going to say, I don't disassociate. I am hyper aware, and I'm, I fixate on things. And so I think that response of, and I also, having being a little bit further away from my surgeries, you're always kind of waiting for like that end date of when you like have closure around craniofacial surgeries. And there's really not, craniofacial is part of my life. That's part of my identity, and that's part of who I am. And so it's not really like there's no end to craniofacial differences. The surgeries may have ended, but there's no, I think that's hard to grapple with sometimes, like waiting for like the closing end of that chapter when that chapter is part of my entire life.
Right. So we have a question. I have Trisha Collins and a mom with 3 beautiful boys. My youngest has TCS as well. What are your thoughts about having surgeries at a young age versus waiting until the child can make their own choices? It's a great question. Does anybody want to, Nicole, what are your thoughts on that?
I think, again, this is so situational. I am really grateful that my parents went ahead with my surgeries when I was too young to make a decision for myself. I think that for some patients that can be really, really important to not wait. Other times, if it's a more minor procedure and there is wiggle room in terms of the urgency, I think it can be really good to get the patient's own perspective and opinion. So, but I think if I had to just give one general answer, I would say if it feels like an important procedure that, time is of the essence, I would just go through with it.
And Ava, did you want to add to that?
Yes, Nicole, I agree with you. My parents have always made the best decisions for me possible. They always put me first, but they also wanted to make sure that the surgery was beneficial both for not only appearance, but health-wise as well. Was it going to make my life more beneficial? And I'm very grateful for my parents for giving me all the surgeries that I couldn't make a choice about, and how far I've come with their support. But now I'm grateful that I have my own voice to decide whether or not I'm ready for my surgery. And if I'm not, my parents are also very understanding and 100% back up all my decisions. So I'm very thankful for that.
Yes. So how, before we wrap up, how do you think you've learned to accept what has happened, if you've accepted it? And and I personally think that can be a challenge. Acceptance is a hard one, but I think it's necessary in order to move forward. Anybody have anything they want to say about that? Howie?
Yeah, sure. So I was not born with a craniofacial difference. I got sick, and luckily the cancer was found when I was 10, just during a routine, just getting X-rays for braces. They found a big tumor. So I often have to remind myself that there's a reason why that X-ray was taken, and we found that, because if it wasn't found, then who knows, So I really feel like I'm meant to be here, and I'm meant to do something impactful. That definitely keeps me moving forward. And then sometimes I just say to myself, like, how cool is it that you got through this? Like, you're so cool for getting through that, and for being just like a strong woman to get yourself to the doctor's office or to the hospital and get yourself through healing. Like, I think that takes so much out of someone, and to be able to still do what I do every day and like be happy with it, I'm just really proud of myself. So I think we all should be too.
Yes, I was going to say, I think we should all be proud. Okay, before we wrap up, how important is it to talk about it, to tell someone about the trauma, like a mental health professional, or to find a community of people who understand? I know, Howie, you've said that I know that you wish you had a community of people who could understand what you were going through when you were younger. Can you share about that and how it might have made a difference in your life if you had that community? Howie?
Yeah, totally. I mean, I didn't know anyone who had gone through anything like I had. We didn't know any doctors who did anything that could help me at the time when I was young. I still am constantly trying to find doctors and find other people who can relate to me and all of the other symptoms that come with having craniomaxillofacial surgery, the ear issues, the eye issues, the nose issues. Like, people forget that it's actually in your head, and you do a lot of things in your head. So I definitely have struggled to find community. I'm so grateful for finding myFace recently. And especially as an adult, I think it's actually really helped me with the closure that I needed after all those years, to know that there's other people out there. There's other people that I can also talk to and help tell about my experience, to maybe help them through their experience. I think especially as a child, it would have been amazing, but I'm really, really grateful to have it now.
Thank you. Rena, did you want to add something?
I wanted to answer your prior question that,
Okay.
I didn't know anybody who had a craniofacial difference growing up. And now I know lots of little kids who have craniofacial differences. And I think having that ability to share my story and my experiences now and give parents and kids, some guidance or some hope that it's not the end of the world. It's actually, there's a huge community of people, and it's just part of being unique, and that they can get through it too, has been really empowering.
Yes, so I just want to add that we have a comment. You guys give me hope that Jake, I guess her son, will be okay and will be as courageous as you gals. So I think that is a great way to wrap up our evening. But I just wanted to add maybe my key takeaway from tonight is that while strength is a byproduct of trauma, I think strength doesn't really lessen the trauma and suffering that people have experienced. That trauma probably damages people more than it strengthens them. And our society likes to focus on strength, but what I think is that trauma survivors need most is understanding and permission to be vulnerable and seen. I just wanted to say, unless anybody has any last key takeaway, I just want to say thank you so much for all of you for opening up tonight and sharing, and I think giving hope to so many out there who are on this journey, and for parents who might be beginning this journey with their kids. So I thank you so much, everybody, for sharing. and so much of yourself today. Thank you.
Thank you, Dina.
Thank you.
Thank you. So please be sure to join us for part 2 on trauma with special guest Bashir Dobson on Wednesday evening, February 2nd at 6 p.m. Eastern Time, 3 p.m. Pacific Time. I'd also like to remind everyone that myFace has virtual support groups for adolescents, adults, and parents. If you'd like to join any of our support groups, email me at dina@myface.org. For 70 years, myFace has been dedicated to changing the faces and transforming the lives of children and adults with facial differences by providing access to holistic, comprehensive care, education, resources, and support that pave the way for better outcomes. To learn more, please visit myface.org. If you want to support the work of myFace, please consider making a donation by visiting myface.org/donate. And if you haven't already, please be sure to subscribe to myFace's YouTube channel to catch future live broadcasts of myFace, myStory. You can also listen to the audio recording on your favorite podcast app, including Apple Podcasts, Google Podcasts, Spotify, Amazon Music, and iHeartRadio. And if you'd like to receive email reminders of new episodes, sign up at myface.org/mystory. That's myface.org/mystory. Thank you.